My name is Susanne Blichfeldt. I'm a pediatrician. I've been working with Prader-Willi for many, many years. Since the start of the International Association, I have been involved here. And I also have a son who's 44 with Prader-Willi syndrome. And I am leader of the advisory board in the Danish Prader-Willi Association, and I work also for the IPWSO clinical and scientific advisor.
My name is Larry Genstil. I'm a psychologist. I've been working with people with PWS since 1979. First in the United States. I'm from Los Angeles originally. And since 1986 in Israel. I married an Israeli. We've lived here now since '86. And I opened a group home for people with Prader-Willi in 1993. And 2.5 years ago, I semi-retired. I still work there part-time as a psychologist, but I'm not running it anymore. I'm the psychologist of the multidisciplinary clinic for Prader-Willi syndrome in a local hospital in Jerusalem, Shaare Zedek, and I've been a member of the PPCB since 2010.
So I just thought about it. Some are aging before expected, so we always have to consider all the individual needs, and we have to look at the individual. Yep.
Also, I've seen over and over again the decision by caregivers if a certain behavior is a decline in functioning or is it a behavior. And many assume it's a behavior because it didn't appear so much before and now it's getting worse, and therefore the demands by the staff of the resident are not appropriate, and they need to take into account that people do decline with age, as we all do, and if there's a decline you cannot treat it as a behavior. It has to, they need more support and more help.
Yes, they should be careful that no medical problems are unknown or overlooked, and we know from research that this can happen. So also psychiatric symptoms can arise and can be caused by a medical condition that causes a change in behavior that is sometimes interpreted as a behavioral problem, but it might be caused by a physical.
The other thing is, in Israel we have a multidisciplinary clinic. I'm the psychologist in the clinic, and every person in the country with Prader-Willi syndrome is seen in the clinic once every 12 to 18 months, and they're given lots of testing to be done, medical testing, and a diet plan, and psychiatric medication if needed, and endocrinological, orthopedic, and for the girls above age 15, gynecological. I do behavior planning there, and because of the medical emphasis, a lot of the kinds of problems that Susanne described in our workshop are caught and dealt with, and I would only be happy if every country had such a clinic. It's a godsend, a real godsend.
Yes, I just can, from Denmark we have 2 centers for rare diseases where also children and adults with Prader-Willi are followed regularly. I just gave a very short answer to this. Very varying. It varies a lot.
Yeah.
Yeah.
The other thing with us is that some of them don't understand in the beginning of the decline why they're not able to do things they did before, and their solution to themselves is to just stop trying. And I think one of our needs as staff people is to help them continue to try and do as much as they can and give more support where they do less.
Well, I will just say take care of all the medical care, that all needs are fulfilled, and do not say to staff, do not misunderstand behavioral problems, but look for reasons, and behavioral problems need personal assistance, and if there is a psychiatric disease, it can be treated also with medication and with good result.
One of the things that I've learned in this conference and in this workshop is that we need to expect aging and not just stumble upon it as it occurs. And I think that will help us be better. It will help us provide services immediately as opposed to trying to figure out what's going on. And that's, I think, one of the main things that I learned today.
And to give individual support, that's so
I think that the main piece of advice I would like is for the researcher to do more work on aging, because there's very little, and a lot of it is description of 2 cases or 5 cases that you can't generalize. So there's so much we don't know, and the more we know, that needs to filter down to the caregivers.
yes. And also for new staff to accept that Prader-Willi syndrome is a special condition. It's a genetic disease, and this you cannot change. You have to accept the problems that there are, and then give the best possible support.